Contractions aren't just during childbirth. After birth, they come back again to facilitate the expulsion of the placenta in particular. As for back pain, it is the logical continuation of diapers. You carried baby for 9 months, your body has retained some after effects. But nothing definitive, rest assured. Postpartum contractions, is it normal? After baby pointed the tip of his nose, did you think you were done with the contractions? Oh no. They reappear immediately to facilitate the expulsion of the placenta, compress the blood vessels in the uterus, and thus limit postpartum bleeding. After delivery, it takes 2 to 3 months for the uterus to return to its original size, that of a tangerine, and its original place, behind the pubis. They say he involutes. Thanks to whom with the hormone oxytocin into those same contractions called trenches. They continue for 2 to 4 days and are quite painful for women who have given birth several times and those who are breastfeeding. Paracetamol may be prescribed for you, or even an anti-inflammatory, if you are in severe pain. The plus of the editorial: for a few days after birth, the uterus is heavy and infiltrated with edemas. You always have the impression of being huge. And since the ligaments it hangs from are still loose, it is pushed down and presses on the perineum. Hence a feeling of heaviness. To relieve the perineum, lie down during the day. Why do you think our great-grandmothers were bedridden for weeks? Take a nap at the same time as the baby, stretch out on the sofa during visits. At first, lying down is preferable to sitting, which is itself better than standing. Back pain after baby, does it make sense after childbirth? The weight gain, the hormonal impregnation that relaxes the ligaments and the stretching during childbirth have put a strain on your back. So that your postpartum pain does not get worse, be careful while carrying your baby. To lift it, put one foot in front of the other and bend your knees. During postnatal visits, exercises are offered in addition to strengthen the abdominal and back muscles. They are based on breathing and intensify as the rehabilitation sessions progress. Be careful, some exercises, such as those that are still sometimes done in gyms or in some physiotherapists, are catastrophic for the perineum. Witch pedaling, scissors and chest raises that strain the muscles called rectus abdominis. They put pressure on the perineum and push it down. The solution movements that primarily involve the transverse muscle, located along the length of the abdomen, itself connected to the perineum. When it is contracted, the latter does the same by reflex. An example: in the position on all fours, we tighten the perineum at the time of exhalation. At the end of the exhalation, we put in apnea while tucking the stomach for a dozen seconds. Please like, share, comment and subscribe.